It's great to be here with you too. I'm very excited for this conversation around planetary health. Both Annie and CANE are focused specifically on the intersection of human health and the environment. I love how you all often refer to us as your counterparts. You're our Canadian counterparts, and you're your American counterparts. So it's great to have this joint discussion. And today we are co-hosting this timely discussion on planetary and health and nursing in the build up to the International Council of Nurses 2023 Congress. That's going to be in July. And just a reminder for folks who are joining this live on Facebook, please make sure you like and share this live and interact with us through the Facebook comments. We're going to be taking questions throughout the live, so pop them in throughout the chat, and then we'll just post them in as comments, and then we will have a Q&A portion at the end, and we'll try to get to as many questions as possible. Also, make sure that you join Annie and CANE in conversation on social media throughout this month by following the hashtags, hashtag Planetary Health ICN and Nurses for Planetary Health, and that's the number 4. And we'll pop those hashtags in the chat so you have them. So make sure to engage with us on conversation on Instagram, Facebook, LinkedIn, and Twitter. And I'd like to just take some time to introduce our guest today before we hop into the conversation. So first, our first guest speaker today is Aggie Black, who is Director in Research and Knowledge Translation at Providence Healthcare in Vancouver, British Columbia. She is actively involved in climate activism through her workplace, environmental stewardship team, and in her community. She supports clinicians in research projects and KT projects, including ones that reduce the carbon footprint of the healthcare system. Aggie is also an adjunct professor at the UBC School of Nursing and Research Associate Center for Health Evaluation and Outcome Sciences. And then we also have Fiona Hanley today, here with us today. And Fiona has been a longtime passionate advocate for nurse leadership in environmental and climate health, and has been engaged in multiple activities and collaborations to advance planetary health and nursing practice and education. She is a co-founding member of CANE, and more recently, Fiona collaborated on a joint project with CANE and the Canadian Federation of Nurses Unions to create a planetary health toolkit for nurses, which we'll hear more about later in the discussion. So to really set the stage for why we are having this conversation, why we wanted to host this live, I wanted to just start us out by talking a little bit about what planetary health is. And I actually was perusing the CANE website where I found this definition or our thought that you all have put forward and how you as an organization have defined planetary health. And so it states, planetary health is a recognition of the fact that human health depends on healthy natural environments and ecosystems, and moreover, that we as a civilization find ourselves at a tipping point. We have depended on our natural systems to promote human health to the point where the human population is healthier than ever before. But to achieve this, we have exploited the planet at an unprecedented rate. If we want to continue to safeguard human health, we also need to maintain the health of the planet and its natural systems on which we depend. That's powerful. And I really think that gets to the idea that we cannot separate ourselves from the natural world. In order to advance human health, which we do as nurses, right? We must advance planetary health at that same time. And so I just want to pause and see, since that's CANE's, definition that you all put forward, and it really resonates with me, and I think Annie as an organization, I just wanted to see Aggie or Fiona, if you have anything to add in terms of how you all view planetary health as an organization.
Yeah, I mean, I think that planetary health is a way of understanding it. It's evolving over time in the way that we think about it and reflect about it. And I think one of the very important things to recognize really is that planetary health is rooted in Indigenous knowledges. And we have to have the humility, if you like, to accept that we are not the ones that have invented this way of thinking, that Indigenous populations around the world have understood this for millennia, that they've understood very much that very intricate and intimate connection with nature and the importance of preserving nature, and you know, the fact that humans only thrive when the environments around them thrive, when animals and plants thrive, I think that that's something that we really have to recognize and to absorb, and also the importance of you know, collaboration with Indigenous peoples and Indigenous experts. They're the knowledge holders and the knowledge bearers.
Yeah, I would just add on to that, building on what Fiona said. There's an Indigenous physician in British Columbia, Shannon Waters, who says the ecosystem is our health system. And I think we, you know, meaning that we can't just think that healthcare happens here in the hospital, that it's how we treat the environment is going to impact every aspect of how healthy we're able to keep our populations, and refusing to make that connection, you know, imperils all of us. So I think I absolutely agree with what Fiona said, that my concept of planetary health comes from what I've learned from Indigenous healthcare providers, Indigenous people in BC and across Canada, and their understanding for millennia, as Fiona said, that those things are absolutely interconnected. And I think it's becoming more and more apparent the ways the health of the environment impacts our health in terms of air quality and heat waves. And British Columbia has been particularly hard hit by climate change, you know, really strong examples of how climate change is impacting our health and the health of the environment. So, yeah.
Thank you both. And I really appreciate you all grounding us and where these concepts, specifically planetary health, have originated from. You know, this planetary health is a relatively new concept in nursing, but, you know, people have been doing this type of work for decades, and not necessarily calling it planetary health because it's been ingrained culturally and how people, Indigenous people specifically, just go about their daily lives. And so I think it's really important, as we're thinking about how nurses enter into these conversations, that we are recognizing that work that has got us to this point. But I also think, you know, nurses have a unique perspectives to offer to planetary health work. You know, we think holistically, we are systems thinkers, and that fits well into how we think about this interconnectedness between the planet and all life forms. And so, speaking a little bit about ANHE's, you know, planetary health activities that we have been working on over the past, you know, few years or so, it's really been ensuring that the nursing perspective is added to that conversation when we talk about issues of climate change and planetary health, that, you know, nurses have an understanding, but also that nurses are you know, bringing their perspectives to conversation so that we can, you know, we need everyone to move these pieces forward. And so we're helping to elevate that nursing leadership. And so over, you know, the past few years, we've been able to send representatives to, you know, international discussions. We had representatives at COP26, COP27. We're planning to go to COP28, and that's the United Nations Climate Change Conference, or they call it COP, which takes place on a yearly basis and brings together world leaders and civil society to look at the progress that's being made under the Paris Agreement. And this is really kind of, there was health professionals that were attending these meetings, but the past few years is the first times that we've had nurses that are joining. And, you know, we've worked really closely with our CANE colleagues and other global nursing organizations to plan activities around these international discussions. And it's been really important as we think about how we move forward, not just, you know, with nurses in the US, but as a global community. And, you know, we also did some really cool collaborative work with CANE in the lead up to COP26, which was 2 years ago now. We pulled together a climate justice agenda for nursing, and that was, CANE was a partner, but also we had partners in Latin America, partners in Europe to help us pull together this climate justice agenda for nursing. And our reason for having this agenda was that climate justice, planetary health was being talked about and being worked on for decades. We had Indigenous communities, we had environmental justice communities that were putting forth principles and ideas of how we can solve some of these planetary health crises that we're facing. But nurses really needed to be, they either weren't talking about it or it wasn't kind of mainstream nursing. We had pockets of nurses who were doing this type of work. And so we really wanted to put that at the forefront, showcasing what others have done, and then adding that nursing perspective. And so we'll pop the climate justice agenda in the Facebook comments so you can kind of take a look at that. But the small group that we convened came together to pull together this agenda that looks at actions that nurses can take to address climate justice while centering the voices of those that are most impacted. And so I just want to give you all an opportunity to share, because CANE does such amazing work, and I'd love to hear what are some of the initiatives that you all are doing around planetary health. Just give us a snapshot here.
Well, maybe I can just a couple of things I can mention is that we do have a committee of that's called the Truth and Reconciliation, Environmental Justice and Reconciliation, a committee at CANE, which I'm not actually a member of, but it's a very active committee looking exactly at those kind of issues as well too. And I think in this country, when we talked about Indigenous populations, their understanding about planetary health, but also very much the Indigenous populations who are, suffering the impact, feeling the impact the most of climate events and biodiversity loss, which is the other COP series. That's also very critical as well too. And so that is something that underlines a lot of the work that CANE is doing, that those kind of understandings as well too. Building on the understanding that environmental justice is a fundamental concept of everything that CANE members do. I mean, I don't know, maybe I can mention a couple of things. One of the things that we have been doing for the presentation that we're planning to do at the ICN about CANE is to map out a little bit about some of the work that members are doing. And we thought it would be kind of fun to map out across the country to have a bit of a visual of our members, because like the US, Canada's a big country too, with a much smaller population, but we have members across the country from northern British Columbia out to the Maritimes, and many people doing all kinds of amazing work. So when I think about some of the stories that we've heard about, when I think about Deborah Katz, who's in Vancouver, BC, at the Langara College School of Nursing, and she's been integrating climate change, environmental health into her teaching, but also, I think this sounds like such a great project, has recently co-authored a graphic novel for children on climate action. And then there's going to be an educational toolkit called SaveThePlanetBook.com that she's working on. Another member is a postdoctoral research fellow who's looking at the issues of women who are impacted by forced migration, including climate migration. And including those kind of issues into her research projects as well. Barbara Astle, Dr. Barb Astle, has led the interest group with the Canadian Association of Schools of Nursing for Planetary Health, and co-authored, along with colleagues from ANHE, the Planetary Health Education Framework. And she also contributed to textbooks on fundamentals of nursing. And if I can sort of put in a little plug for their session as well too, that they're having on the 4th of July at the ICN Conference. She's co-developed along with Teddy Potter, Heidi Honegger-Rogers, Jessica Leclerc, the values and ethics of planetary health, which will be presented on the 4th of July at the ICN Conference as well too, moderated by Deanne Shepherd, another CANE member. far as from Nova Scotia. I don't know. I mean, I can mention a couple of other stories if you like. We have, if I think about in Alberta, Lindsay Komar, who's Alberta co-rep, who did this amazing Prezi on planetary health to help nurses understand about planetary health and nursing as her capstone project when she graduated from her master's. And she's just published an article, co-authored an article about preventing, recognizing, managing heat injury in children in the journal Pediatrics and Child Health. It's from May last month. I think of here in Montreal, we have students as well who are doing amazing things, like Naomi Pastrana-Mankiewicz, who co-chaired and co-founded the McGill Nurses for Planetary Health. She's a nursing student at McGill, has working on multiple projects to kind of bring in the ideas of sustainability into the nursing faculty. Also, advocating with the Board of Governors for divestment of McGill's at McGill University as well too. So another big dynamo. Other people like Bonnie Hamilton Bogart in New Brunswick has been working in the area of policy for many years, and they've actually put together a proposed environmental bill of rights to protect children in New Brunswick, in the New Brunswick legislature. So working very hard on those kind of things. So, those are some of the things. So those are some of the stories, and we will be able to share some of those stories at our presentation that Aggie and I will be presenting as well on the 3rd of July, I think, Aggie, isn't it?
Yes, yeah. The only thing I would add to that is one thing that strikes me listening to Fiona is when you join a group like CANE, which I only did a year and a half ago, so Fiona's been involved in this group much longer than me, is you realize how many nurses are doing things. When I joined, I felt like I was the only nurse I knew interested in planetary health. And then I realized they're all across BC, and actually British Columbia has quite an active group led by Helen Boyd, who meets monthly, and there's always a presenter who is a nurse in BC doing action on climate change. So we get to hear about what each other are doing, be inspired by what each other are doing, realize we want to join people in some of the work they're doing. So the only other activity I would add is I'm on the social media advocacy committee, and we've been really trying to get more nurses to use social media effectively to get planetary health messages out. So we do that by, oh, sorry, it's gotten a little loud behind me, so I'll pause there.
And, I really love how your examples that you presented really hit to this kind of, I think, buzzword that's been coming around in nursing is innovation, graphic novels, social media, all these really cool, I mean, nurses are natural innovators, even if they don't think of themselves as that. And we just have such creative ideas, and you can see that reflected in the work that's being done through, the membership of CANE. Our organization will also have presentations at the Congress. Annie's executive director, Katie Huffling, she will be presenting at the student assembly, which is going to be right before the Congress, which is really exciting because that's where a lot of energy lies right now within nursing when we talk about these concepts. I will be presenting on the ANHE's fellowship, Environmental Health Nurse Fellowship Program, which we are hopefully launching a 3rd cohort sometime in the fall. And that is our year-long fellowship program, which partners nurses with community-based organizations to really work together to address environmental health issues in a way that centers community and centers that knowledge that is there and helps to advance the solutions that are coming out of those community organizations, and pairs that perspective and skill set the nurses can bring to a lot of this work, and just really help build those collaborative efforts. And I think this has been a unique modeling. I know I've been working with a couple of your colleagues at CANE to hopefully do something similar in Canada, because I think it's just such an adaptable model. So I'm really excited to be talking about that with our global nursing colleagues. And also, I just want to, for folks who aren't familiar with the International Council of Nurses or their Congress actually happens it happens every 2 years. And so, you know, I think for the United States, we're lucky that it's in really close in Canada. So it's not too much of a trek for us. So we're excited. This will be my first time attending. I'm very excited to meet many of these colleagues that I've been communicating via email with, and to finally meet you all in person. But, you know, ICN has really been a strong leader when it comes to planetary health and climate change. They do have a position statement which they put out in 2018, emphasizing that nurses really have a shared responsibility to protect the natural environment. And they've also, you know, been working with international bodies like the World Health Organization and the Global Climate and Health Alliance to really bring nursing to the, you know, the forefront and show how nurses are leading. And, you know, this year's Congress is focused on nurses together, a force for global health. And I just want to throw some numbers out there. You know, worldwide, there are something about 28 million nurses. And so when we think about just those sheer numbers, that's really powerful when we think about how we can be change agents. And also, you know, we're extremely embedded in the communities in which we live and work. And so I think that puts us in a position to really be drivers of action in the promotion of planetary health. And so I just wanted to hear from you, Fiona and Aggie, you know, how do you see the theme of the ICN Congress this year relating to planetary health? And what would you like to see from the nursing profession around this topic?
Oh, that's a big question. And maybe before I answer, and Aggie, you know, please jump in. But I also just want to give a shout out maybe as well too to, you know, the fact that this is happening in Canada, and so the Canadian Nursing Association is actually co-hosting the ICN Congress in Montreal, which is also very easy for me because that's where I happen to live as well too. So it's just a simple bicycle ride for me to get there. But I think just also to, you know, recognize that the Canadian Nursing Association itself has had a long history of leadership in the area of environmental health and climate change over many years, actually. And really it was, you know, thanks to them that our association was founded, really, because it started out as a centennial project for them in 2008, 2009. Based on them hearing about how concerned nurses were about impacts of the environmental health and wanting to be able to support nurses to be able to work in this area. And so I really want to just give a, you know, recognition to that as well too, with this upcoming Congress. And you know, it's also the first time that I've had the privilege to go to the ICN. You know, I think many of these big congresses around the world, I think it is sometimes hard for nurses to attend for distance, you know, funding and all of those kind of reasons as well too, that makes it difficult for sometimes nurses to attend to these kind of conferences. So certainly I would like to have more funding opportunities for nurses who are from far away or from communities or in a work environment where it's harder for them to get time and funding to be able to attend these conferences, to add their voice. I think that would be very important in terms of issues of equity. And, you know, talking about environmental justice as well too, we really need to hear their voices. So we need to be able to make it much more accessible for nurses to be at some of these big events like this upcoming ICN Congress as well too. And I think, yeah, I think planetary health, climate change, environmental health are, just from what I know so far of the people that, you know, we know with ANHE and CANE and some of our UK colleagues as well too. I think there's quite a lot of focus in terms of climate change and planetary health, and that's really good. And we certainly want to see more of that as well too. We want to see much more dedicated time to discussing the kind of issues and yeah, what we can do as nurses and how we can move ahead with this at a time of climate crisis, which people are, you know, we've just had last week, we could hardly see outside. It wasn't as bad as the air in New York, but certainly we've had lots and lots of wildfires here in Quebec as well too. And the air quality was very poor. We had very hazy days. And that also relates to Indigenous knowledge as well too, in how we manage our forests. and the monoculture that has been happening in the way that forests are managed in this country as well too. So yeah, also having more of a place for indigenous populations at these communities, and you know, the people who are the most affected by some of these, who are being impacted the most by this. Aggie, go ahead.
I would just add to that, I think the theme for the ICN really fits well with nurses as advocates and nurses as a force for change in terms of social justice. And I think most nurses I know really do see themselves as advocates. They take that part of their nursing role really seriously. And while many of them think about it as advocacy for the individual patient, helping them find housing or helping them find a mental health support or drug treatment programs, I think it's up to us who are involved to encourage them to see advocacy as a much broader thing, and to see that they can use their nursing voice, which is, trusted, and we're numerous, we're trusted, we're evidence-based, we're all taught to be good communicators. So I want to see more nurses like this, the force for change. I want to see more nurses really thinking of advocacy on behalf of the planet and planetary health, and really lifting their voices in that way. So I love the theme, and I think it really fits with advocacy, social justice, nursing, and nurses as a force for change for planetary health.
Absolutely. And I think having the Canadian Nurses Association as a partner to this Congress is really important. I know, you all have been moving things really forward when it comes to planetary health, and having a lot of support from, that nursing body within Canada is so important. I know for us in the US, the American Nurses Association did put out some strong statements. I think in 2008, we had a climate change statement. And then for, a little bit, it was kind of, silent, supportive of issues, but maybe not necessarily taking, a front and center role. But we've seen renewed leadership from the American Nurses Association. I know we've been collaborating with them to update their position on climate change, and that they just finished the public comment period for that. And that should hopefully be out within the next, I think, month or so. If it has to go through the board of directors, of course. But that renewed leadership, I think, was driven by the state nurses associations and pushing that leadership forward. And so I think there's kind of this groundswell that's happening, and what I'm hearing from you all, I think that's happening in Canada too. And so I think, at least for me, some of the things that I think are really important that I'd like to see from nurses is how do we reach kind of the nurse that is, maybe not as well versed in climate and health issues, but is concerned and wants to do something about it. How do we reach those nurses and really energize them, so we're not just speaking to this select few folks that are really climate concerned, but that we're helping to move the broader profession along. Because I know when I was working at the bedside, these issues weren't necessarily at my forefront because I was working in acute care. I didn't even know that there was an International Council of Nurses. I was, very, peripherally involved with the American Nurses Association. But I think a lot of that organizing is happening within nursing associations. And I think that is really powerful, because then, like Aggie, you were mentioning, you're not feeling so siloed, because you're joining with a community of nurses that are, have a shared goal of advancing planetary health, which I think is powerful. And I think, when I think about the theme for ICN, that whole, thinking about global collaboration, because that's what we need when we think about planetary health. And so I'm also really excited to hear, from the countries that I know are doing great work, but perhaps don't necessarily get the recognition like, those of us within the US do, or within Canada, that we actually hear from our colleagues in the global South and what they're doing. I think that's going to be really exciting for me. But I'll just take a quick pause and see if we have any questions coming in from Facebook. And for those, just a gentle reminder for those who are tuning in live, you can go ahead and pop your questions or comments in the chat. And we will share those with Fiona and Aggie and get your questions answered. But while we're waiting for any questions, I'll just kind of jump us into some questions that I have. You know, I think we've talked a lot about you know, systems change, policy and advocacy. And so I'm wondering, how does policy and advocacy and that kind of systems level change play into your work relating to planetary health?
Well, I think part of the advocacy is really what you have talked about already too, that the recognition that this is something that we need nurses. We need nurses to be there, and that change is not going to happen in healthcare without nurses. You know, they're the, you know, we've heard all the reasons why they're the backbone of the health care profession. And so having policy that recognizes that this is part of the nursing scope of practice to act on climate change, to take those aspects into consideration in the care of patients, from, you know, all through the whole cycle of care, from admission, pre-admission, all through their whatever kind of care that they have, to when they're discharged in the community. I think recognizing that nursing has a responsibility there and has a very important role to play through all of that. But also in community advocacy, you also mentioned, you know, the communities where we live, those are the places that we feel the impacts as well too. And so nurses are often very important because of all the reasons also already named, about helping to people understand what some of those impacts are on health within communities, and the fact that the things that we do in our communities are beneficial for health. You know, hearing nurses talking about the fact that, yeah, having more bike lanes, having communities with more tree canopies, having sidewalks where people can walk, having traffic calming measures, having cooling areas accessible for people, having housing, you know, urban density, urban housing, all of those kind of things, having public transport that's accessible, that's wheelchair, you know, friendly, that's accessible for people who have mobility issues. All of those things are really important, and nurses need to talk about that as well too. And I think having policies to kind of frame it in a way that, yes, this is part of our role. We do have an expertise in this area. I think that helps for people to recognize those things as well, and to help advance policy at whatever it's in the municipal level, within the healthcare organizations, at the regional, national levels, etc.
There is construction noise behind me. I'm really sorry. Is it very distracting? Can you? Okay. All right. So a couple of things that we've done. One is we have an environmental stewardship team at my workplace, and we've not only supported or encouraged all nurses to join it, or a few nurses to join it, but we pay people for their time. So if a nurse comes on his or her day off, at least they're paid to attend. And that's been fantastic because we've gotten more of them involved, and then we hear more of their voices and their concerns. And also on the municipal level, I live in a little town just on the edge of Vancouver, and we started a climate collective on Facebook. And so we have meetings and we strategize how we can bring things to the city council. There's a city council member actually on our collective. So we're trying to use, that's not all nurses on that, but there are nurses on that climate collective. So we're trying to, again, speak, not like, I don't speak as a representative of my healthcare organization. I speak as a registered nurse to say to city council members and the mayor, I have these concerns, and it's, you know, wearing my hat as a healthcare professional. So I think systems change can come from people, nurses stepping up in their workplace, in their town, wherever your sphere of influence is, but beyond making individual changes. One of the planetary healthcare professionals I work with says, we're not going to recycle our way out of this mess. You know, it's not enough to say, I'm a good citizen, I recycle my newspaper. We've got to be way more active than that to make systems level change. But the other thing I have really loved is nurses signing as nurses when they write letters to the editor or op-eds in the newspaper, so that you can see, wow, there are other nurses across BC and across Canada who are saying, as a registered nurse, I'm concerned about planetary health, and I hope people will do these things. So I think just using the nursing voice, raising the nursing voice, having more of us contribute and identify ourselves as concerned because we are nurses and advocates, and is really key.
And maybe I'd just add to that, Aggie, I think those are great. I think, you know, speaking as a nurse educator, of course, we have to be able to give nurses the education that they need from the very beginning of their nursing education. There, it has to be integrated into there. And I do see more examples of that. I've actually spent the last year working with one of the CEGEPs here in Montreal, the colleges, which is one of the, you to become a nurse in Quebec, you either go through a college or a university. And they have a college-wide project to integrate climate change into the curriculum, including within the nursing department. And so it's been incredibly inspiring working with nursing teachers who themselves have many, many ideas, who are already doing some of that work, but helping also others to make the connections between the fact that this doesn't have to be an extra huge burden on the education for curriculum that's already very full, but making links within things that are already being taught about whether it's cardiovascular disease, whether it's asthma, whether it's cancer, whether it's, you know, medications. There are multiple opportunities to be able to weave this into the curriculum, and so I think we're seeing more of that as well too. That the more recognition that that it is possible, and that there are multiple ways to be able to do this as well too, and that it is hyper important that nurses from the very beginning of their education, this becomes a normal part of their education, to understand about the links between their climate and health, the importance of preserving biodiversity, avoiding plastics, you know, understanding that climate change is a health issue.
Yeah, absolutely. That's all so important. And I think kind of what you two alluded to is that it happens within nursing, happens, you know, across health disciplines, and then it happens, you know, beyond the health sector. It's really kind of a joining together. And I think that's why these multidisciplinary cross-sector collaborations and partnerships are just so important, and why it's important for nurses to be included in those conversations, because, you know, that's how we're going to, you know, solve this crisis we're facing, through that collaboration. And, you know, I think one more question before we close out. Do you have any words of inspiration for nurses that would like to get involved with planetary health activities, but aren't sure where to start?
Well, the most obvious for us, I think, is for here in Canada to have people join our organization, the Canadian Association of Nurses for the Environment, because really we've talked about partnerships, collaboration, how important that is in being inspired by other people, being energized by other people, by learning about all the creative kind of ideas that nurses have. Across the country, across this continent, around the world, because once you join an organization like ours, then you're immediately connected to ANHE, to other organizations around the world also doing remarkable work as well too. So I think that is very key, is not feeling alone and lonely in this and discouraged, because it's easy to be discouraged and to feel like you're the only one. To join an organization where you can be part of it and moving projects forward, and certainly we're seeing there's a kind of explosion of projects that are happening in our organization at the moment as well too. So that's what I would recommend. And you know, we need ideas, we need more ideas, we need creativity, we need people, we need their inspiration as well too.
Yeah, I would agree with that. Joining an organization so you don't feel so alone, so you have some examples. You know, I've had nurses say, I don't know where to start. I don't know what to do first. So I would say join either at your workplace, join CANE so that you're part of a national organization. Go to I went to a planetary health rally And that's where I met Helen Boyd, and I heard her speak like on behalf of nurses of BC. And I was so inspired that we had that kind of nurse leadership on planetary health right in my own backyard. And, you know, so I was going to like follow her anywhere because she was saying all the things I wanted to hear nurses say in terms of using our voice and being active and leading change. So, and I also think that being active in climate change issues is the best antidote to climate despair, which I think is something a lot of us and our kids and our colleagues face. And feeling like you're part of a group that is doing small, medium, and big things to make a difference is the best antidote to feeling alone or anxious about the climate.
Great words of inspiration. But unfortunately, our time has come to a close here. I want to thank you both for this great conversation, for joining us today. For those of you who will be in Montreal for the ICN Congress, please come find us. We look forward to seeing you, hearing about your planetary health work. And we have this, as you heard, there's a number of planetary health focused conferences, presentations, events that will be there. So please come and see us. And just a reminder that if you are a social media whiz or like to join us on the conversation on social media, please post and tag ANHE and CANE and use the hashtags, again, Planetary Health ICN and hashtag nurses for the number 4 Planetary Health. Fiona and Aggie, any last minute comments before we close out?
I'd just like to say thank you, Cara, for facilitating this and for organizing this, and how whoops this big truck going by, and I really, you know, this kind of a love story for CANE, but also for ANHE and our collective work together. And I think that is so important and inspiring. So thank you very much for giving us this opportunity.
Yeah, I would echo that. Thank you. I think of you all, of ANHE, as our sister organization, and I follow all the things you do and take lots and lots of inspiration from it. So thanks for the ways that you're getting nurses involved and supporting them to do great planetary health work. Look forward to seeing you in Montreal.
You're here.
Thank you all so much. And thank you everyone for joining us on Facebook. Make sure you stay in touch with ANHE and CANE. You know, we'd love to include you in our work and our collaboration. So thank you again, everyone.
Thank you. Bye-bye.